let's drill down into some of the specific causes of these mental health difficulties. And of course, you mentioned the pandemic when you're sort of looking at how I know a variety of countries handled the pandemic. What did you observe in terms of, how what opportunities children were given to say go to school, to have social interaction, and then what toll that did take on kids as those things changed and were rolled back?
Yeah, no generation has experienced a childhood quite like this one. In cities, towns, and villages around the world, the lives of children and young people were repeatedly put on hold for over a year, and many are still impacted to this day. And so, what the COVID-19 did was it triggered shocks on multiple fronts that intensified certain vulnerabilities for children, such as increased exposure to violence, neglect, and deprivation, disrupted access to education, as you just said, and social isolation. So, alone or in combination, for many children, these likely led to negative educational outcomes and increased stress levels. Parents and caregivers, of course, were also affected and needed help as they provided the necessary environment and support for children's continued learning and to cope during the crisis. So, yes, less visible, but no less worrying for many is the impact of the pandemic on children, including their mental health. And this is not surprising, given that children's mental health and well being is affected by how well they are supported by their schools and their peers, and even more broadly by the economic and political structures in our societies. And yes, by events like disaster, war, community violence, and major health emergencies like the pandemic, which impacted all of these areas that are usually protective factors for children's mental health.